Do you trust your doctor, or do you trust the government to give you health advice? Well, that's what we're going to be talking about tonight. The shocking truth on health advice gone wrong. It's a show you don't want to miss. Stay tuned. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over to Dr. Osborne's Zone. Welcome to Dr. Osborne's Zone. Today is part one of a three-part series on health advice gone wrong. We're going to be tackling some of the major sacred cows of the health industry and how those are actually incorrect or wrong, or were proven to be incorrect and wrong. And so the point being, we want to make sure that you understand that the science is never settled. Somebody tells you science is settled, run the other way. So let's dive in to the topic of health advice gone wrong. So topic number one, you have bad genes. This was kind of, and still is actually even to this day, this is one of the favorite things that I hear many doctors say, is when they can't answer the question to their patients, they just simply blame it on genetics. Your mom had diabetes, your dad had diabetes, heart disease, whatever it might be. But science has actually proved this wrong, and it's been proven wrong for quite a number of years, but it's still a favorite go-to. As a matter of fact, if we go back as far as 10 years, you can see here on this cover of a Time magazine, you can see why your DNA isn't your destiny. The science of epigenetics, we were talking about this over 10 years ago. It's been written about, there have been a number of major studies on genetics, what we call nature versus nurture. In essence, most of what doctors call genetics as far as disease risk factor is not genetic, but it actually comes from nurturing. The way you were raised, you learned how to eat, you learned how to behave, you learned how to exercise. All your behaviors were taught. So more than saying you have a cursed genome, we should probably say you were taught how to do things that were conducive to the development of disease, which has nothing to do with your genetics. And so if you change your choices, you can change your life. And we've learned this over the years, and especially through twin studies where doctors look at twins and the development of different diseases based on different environments. And so it's pretty well confirmed at this point that genes are not the major role. They play a role, no doubt about that, in disease, but they are not the reason for the most part that people develop disease. Now, there are exceptions to that rule, certainly. Diseases like cystic fibrosis, Down syndrome, genetic inborn errors of metabolism, but these are very rare situations. And again, most people have a great degree of control over their disease destiny if they adjust their behaviors accordingly. So we know that genes being bad are definitely a myth, and it's been one of the major excuses of the medical community for many decades. Number two on our list, smoking is just fine. Now, we all know today that reality is far from the truth. As a matter of fact, smoking's been linked to heart disease, high blood pressure, cancer, diabetes, obesity, and a number of other chronic degenerative diseases, including asthma and lung disease. But there was a time in our history where smoking was perfectly fine and was recommended. And marketers used aggressively, I should add, they used doctors to promote this habit. You can see here we've got some old ads up. Viceroy's filter the smoke, right, with the big exclamation point. You've got a dentist here. I love this. As your dentist, I would recommend Viceroy. So again, this an old ad that was used. You can see here this one. I love this. More doctors smoke Camels than any other cigarette. And again, you got a picture of the doctor with the stethoscope, smooth cigarette in the hands. And then you've got this one. I love this ad. It's a mother and her daughter in the doctor's office. You can see up here on the left-hand side, I'm going to grow 100 years old. That's what we call marketing. And then down below that, you've got a smoking ad. So smoking being associated with living longer. And then keep going, Lucky Strike, this is a pretty famous one here. 20,679 physicians say Luckies are less irritating. I don't know what that means, but they go on to say it's toasted. Your throat protection against irritation, against cough. So again, doctors promoting that brand. And then Camels again, for digestion's sake, smoke Camels. Again, a doctor in the ad. We've got more. You can see why physicians call our new brand a health cigar. That's really pushing it, a health cigar. But again, this is our history, and you have to find humor in it. I mean, this is advice. For all intents and purposes, this is, even if it's not directly physicians giving the advice to smoke, it's definitely pushing the envelope of what should have been legally plausible. You get here, you got dentists vote Old Gold first for throat ease. Again, smoking. Camels, smoke as many as you want. They never get on your nerves. More doctors smoke Camel. Again, that was a big one, the Camel ads. I like this. Leading nose and throat specialists suggest that you change to Philip Morris for whatever reason. I think the message there for quite a while was that certain brands would irritate the throat less. I don't know how true any of that could have ever been. Again, Camels, what distinguished doctors found on comparing cigarettes, call for Philip Morris, America's finest cigarette. So again, no shortage here, just what the doctor ordered, filter tip. I think that the advent of filters somehow made cigarettes healthier. Of course, again, we know the story, I think you get the point, but cigarettes are not okay. But we were being pushed and we were being prodded in the direction of smoking. Certainly there was a social influence. It wasn't just ads by these companies using doctors as pawns. It was also the movies and the TV, promoting the coolness of smoking cigarettes. You remember the guys in the 50s with the white t-shirts and the pack of cigarettes rolled up in the sleeve, and they were tough because they were smokers. And so we've seen this be pushed socially for many years, and of course we know it's not true, and that's my point. Sometimes things our society promotes and pushes are not necessarily what's good for the order. And bonus to anyone who in the comments can bring up a recent example of how society pushed the rest of us to do something that may not have been the best idea. Okay, let's go to number 3. We've got here baby formula, right? If you remember, there was a time when doctors aggressively promoted baby formula in the hospital and pediatric setting over breastfeeding. And certainly this is another example of how society got behind and pushed this mass message. I mean, women were going back to work. Breastfeeding was considered more of a hassle, if you will, as opposed to well, let's just call it a nutritional necessity for healthy young babies. And I'm not shaming any of you who didn't breastfeed, so please keep the comments to yourself if that's what you think. That's not at all what I mean here. But what we're referring to is how aggressive baby formulas were marketed. You can see here formula makers distribute free formula to hospitals, encourage doctors and healthcare workers to give mothers free samples, and use social media influencers to advertise formula benefits to expecting new mothers. Strategies that undercut efforts to support breastfeeding, health experts say. Go on to say, formula milk marketing powered by enormous budgets and the deliberate misuse of science, again, that word science, right? Science is never settled, is driving overconsumption of formula milk and discouraging breastfeeding. The World Health Organization and the United Nations Children's Fund found in a February report. The formula industry systematically undermines parents' infant feeding decisions, the report said, comparing the efforts to tobacco and gambling marketing. So again, we go back in time, if we look at the historical lessons that time can teach us, we allowed because of undue financial influence, we allowed the cigarette and the smoking industry to lie to us for decades and to promote something that was killing millions of people. And doctors were promoting it as well, until we finally came to the conclusion that that was wrong. It was because the evidence became so overwhelming we could no longer ignore it. Same thing with formula, with baby formula. If you ever go to the grocery store and look at some of these formulas, you know, many of them, the number one ingredient is corn syrup, sugar, pure fructose, which we'll talk about later, but that's horrific, right? We don't want to feed our children, our growing babies, a primary staple of fructose is calories. And beyond that, the number of synthetic vitamins and other potentially allergenic dairy-based products that are highly, highly processed that don't even come close to mother's milk. Again, not trying to guilt or shame any of you who didn't breastfeed, but you know, if you didn't, you very well could have been a victim of this marketing campaign, this really, really heavy push. Remember, these companies spent millions and millions of dollars to get their products into your hands and to create a social idea that somehow breastfeeding was less important. And so, you know, we all played a victim to that. I was not breastfed as a child, and probably like many of you, and many of you maybe haven't breastfed your own children, and because that belief or that mantra still exists today, and we're now hopefully starting to make a dent in this equation. But breastfeeding is super critical and super important. So if you can and you produce milk and you're able to do so, it's absolutely the best choice for your child. Okay, let's move into number 4. The only war on cancer is the one promoting you to develop it. Now, we always hear about the war on cancer. You've got big companies that do fund runs every year to raise hundreds of millions of dollars for cancer research, and very little of that research money ever makes it into research that matters. Most of it funds chemo and radiation trials. Of course, the success and track record of those types of therapies is very poor, especially when you look at 5-year survival rates for a lot of cancers. But again, our culture and our society believes it's the thing to do. When you get cancer, you go to places like MD Anderson and go through that whole process that they have set up for you and never really even question it. And again, when people get cancer, what is it that many doctors say? They say, diet has nothing to do with cancer. You need to treat it. And they go right into heavy treatments. Now, no cancer was ever caused by a deficiency of chemotherapy or radiation or lack of surgical removal of a tumor, but many cancers are caused by the day-to-day things that we do. Let's look at what the National Cancer Institute has to say about risk factors for cancer. You can see their list here: age, alcohol, cancer-causing substances, we'll talk about that in a minute, chronic inflammation, diet, hormones, immunosuppression, infectious agents, obesity, radiation, sunlight, and tobacco, all causes of cancer or contributors to cancer. Ironically, you see radiation is one of the forms of treatment used commonly for many different types of cancer. But you know, if we look at some of these things, cancer-causing substances, for example, pollutants, you can see a long list here that, again, that the Institute says are carcinogens. So you see aflatoxins, which, by the way, are toxins found in foods. They're mold toxins also found in many homes produced by species of mold like Aspergillus. And then you've got arsenic and asbestos and benzene. Again, a lot of these are petrochemicals or heavy metals. We had coal tar and coal tar pitch. A lot of food dyes are coal tar derivatives, interestingly enough. You know, those FD&C dyes that are put in a number of foods and cosmetics. You can see here mineral oils, nickel compounds, radon, secondhand tobacco smoke, soot, vinyl chloride, wood dust. Okay, and a lot of just environmental chemicals, household environmental chemicals, formaldehyde, preservatives, etc. So these are all components environmentally that contribute to cancer. And then we have dietary components that obviously contribute to cancer. Probably some of the biggest things in diet are the chemicals we put in the food, the pesticides, the preservatives, and other potential for carcinogenic effect, not good for you items. So read those food labels and try to pick what's good or what's healthy. But again, what we're getting at here, society as a whole really promotes the development of cancer. So we, again, going back to, we have this war against cancer, yet as a society, we promote so many things that contribute to it. The petrochemicals, the pesticides in our food, the preservatives, the dyes, the lack of activity. In our schools today, activity is not promoted. Children are locked down to a desk and there's very little time for physical fitness or activity. We have fast food and convenience foods that are promoting of cancer. The fried foods are promoting of cancer. So all these modern day conveniences that we have that go into contributing to cancer. So as a society, if we really wanted to battle or go to war against cancer, we wouldn't be doing fun runs where they're serving Coca-Cola and donuts to raise money to do research that promotes the use of very dangerous medicines like chemotherapy and radiation poisoning as the means to treat a disease. We would be going backward and reverse engineering what are these environmental triggers and how can we be exposed to less of them? How can we change the way things are done so that we are being exposed to less carcinogenic compounds throughout the course of our life so as to minimize the risk of developing cancer? Number 5, high-fat diets cause heart disease. Now, many of you are maybe aware of this recent expose, if you will, but it was published a few years ago in the Journal of the American Medical Association, Internal Medicine. You can see here, Sugar Industry and Coronary Heart Disease Research, a historical analysis. So in this abstract or summary, you see early warning signals of coronary heart disease risk of sugar emerged in the 1950s. So this is, we're going back 70 years. What these researchers did is they examined Sugar Research Foundation internal documents, historical reports and statements relevant to early debates about the dietary causes of coronary heart disease and assembled findings chronologically into a narrative case study. The Sugar Research Foundation sponsored its first CHD research project in 1965, a literature review published in the New England Journal, which singled out fat and cholesterol as the dietary causes of coronary heart disease and downplayed evidence that sucrose consumption was also a risk factor, sucrose being sugar. The SRF, Sugar Research Foundation, set the review's objective, contributed articles for inclusion, and received drafts. The SRF's funding and role was not disclosed. Together with other recent analysis of sugar industry documents, our findings suggest the industry sponsored a research program in the 60s and 70s that successfully cast doubt about the hazards of sucrose while promoting fat as the dietary culprit in coronary heart disease. Now, what do most people think causes atherosclerosis and heart disease today? Cholesterol, fat. Well, cholesterol technically isn't just pure fat, it's fat with protein, it's a lipoprotein. But, what do you see in the grocery store on the cereal boxes? Lowers your cholesterol. Oat cereals, my favorite one is Honey Nut Cheerios. A sugar-loaded grain-based cereal is going to lower your cholesterol and reduce your risk of heart disease. Yeah, good luck with that. Point being that industry funded scientists to lie. And where have we seen that before? This is a trend historically that we see repetitively over and over and over again. And I say that because you have to question things. If you're not questioning things, you become the victim to good marketing, which we've all been a victim of good marketing. But as you learn the history, you learn not to repeat the same mistakes. The sugar industry funded a trick, right? They basically blamed everything on fat and cholesterol. And what do we have now? We have a multi-billion-dollar industry revolving around the lowering of cholesterol with chemicals that can cause muscle damage and nerve damage. And, people just accept that as scientific fact and truth, and there's no questioning to the doctors. And I would encourage any of you who are, taking cholesterol-lowering drugs, to rethink that concept. We're learning today, I shouldn't say we're learning, we've already learned this, but it's just not mainstream knowledge that cholesterol is vital to health. As a matter of fact, people with the highest levels of cholesterol live longer, and we're talking about bad cholesterol, the LDL. People with the highest LDL have longer lifespans. We also know in 1998, LDL, bad cholesterol, won a Nobel Prize in medicine because it was discovered you needed it to form brain synapses. And this is one of the reasons why we see a lot of people developing cognitive brain fog and neurodegenerative change when they lower their cholesterol too aggressively over years and years and years. So again, sugar's bad for you. Sugar contributes to heart disease. The sugar industry paid scientists to cover it up and blame cholesterol, and that's a part of our dirty history that you want to be aware of. So let's go to number 6. Artificial sweeteners don't affect your blood sugar. Now, we know that's not true, and science has absolutely confirmed it to be not true. Let's pull up a study here for you. You can see here, this published just in 2020, effect of artificial sweeteners on insulin resistance among type 2 diabetes patients. The incidence of diabetes has increased over the past few years, mainly due to our eating habits and physical inactivity. This also includes the use of artificial sweetening agents, which have broadly replaced other forms of sugars and have shown a paradoxical negative effect on blood glucose. Ingestion of these artificial sweeteners results in the release of insulin from the pancreas, which is mistaken for glucose due to their sweet taste. This increases the levels of insulin in blood, eventually leading to decreased receptor activity due to insulin resistance. So let's turn that into real English. What researchers have found is that using artificial sweeteners, which if you look at most, dietitians and nutritionists and doctors will tell you, use the artificial sweeteners, don't use sugar. And they'll tell you to use these artificial sweeteners predominantly because they'll tell you they don't affect your blood sugar and that they're non-caloric, so they won't help increase your weight. But again, in reality, what's happening is these sweeteners effectively make your body resistant to insulin. They cause your body to overproduce insulin, and so over time you develop an insulin resistance, which is one of the pathways to diabetes and obesity and all the secondary and tertiary problems coming with that, which is predominantly heart disease. So again, if you're one of those and you've been told, drinking Diet Coke is perfectly fine and won't affect your blood sugar, you've been lied to, right? And most of this comes from the industry. And again, I don't want to too terribly come down on doctors because they don't study nutrition. You should know that, by the way. Doctors don't study nutrition, so really most doctors aren't qualified, not all, but most are not qualified to really discuss nutritional components with you. So most people don't know that. They go into their doctor's office and they think their doctor understands nutrition because they went to medical school. But in reality, medical school has very little, almost no nutritional education. And so your doctor, again, not qualified to have that conversation with you to any huge degree unless they've gone on to do additional training or certification. But this is a classic example where the industry, and if we look at who promotes these products, these artificial sweeteners, and creates the lie, the big lie, which is they don't affect your blood sugar, they're safe for diabetics, that's industry, right? And the power of that industry and the power they have to run commercials and ads and advertising and to influence policy, to influence healthcare providers is tremendous. And you just have to be aware of that because at the end of the day, with everything that we're talking about, it really boils down to follow the money. If there's money to be made in lying, you can bet that somebody's going to lie. We're going to be lied to, and many people are going to pay a price for those lies until we figure out they're paying a price. So again, the lesson here is artificial sweeteners are bad for you. They do affect your blood sugar. They do contribute to insulin sensitivity, and you should not be under any guise that they're somehow healthier for you because they're calorie-free. Artificial sweeteners, no good. Okay, let's talk about number 7. Trust the science. Now, in medicine, I want to show you just some recent publications that have come out of the journal Science. Again, trust the science. This was published in Science. hidden conflicts. Pharma payment to FDA advisors after drug approvals spark ethical concerns. No kidding, ethical concerns. So the very doctors who are supposed to be the gatekeepers of honesty and safety and integrity in medicine are the very ones that are taking kickbacks and dollars from the companies they're supposed to be regulating. A lot of people have the impression that, the FDA and the CDC are infallible institutes where truth reigns. And the reality is we've known about these conflicts, for decades. They've been problems. This isn't me talking about it, isn't the first time you've probably heard about it, but it's not a little known fact that there's a revolving door between agencies like the FDA and pharmaceutical companies. Generally speaking, a lot of times what happens is drug companies will submit their drugs to the FDA for approval. The very people working the approval process have a desire to go make a fat salary working for the pharmaceutical company. So what do? They favorably approve drugs. In some cases, the big question mark is, should the drug have ever even have been approved? Was it actually safe, or was that doctor on the dole? And ethics and morals at play, bad ethics and bad morals. And this is part of the problem, because you don't ever know how honest these professionals are being when they're being paid by the very industry they're supposed to regulate. So again, science has talked about this conflict of interest numerous times. You can see here in this second piece, FDA's revolving door. Companies often hire agency staffers who manage their successful drug reviews. It's a huge problem in the industry. We've all known about it. Nobody's willing to do anything about it. Politics, right? Politicians generally are also probably taking money for their campaigns from the pharmaceutical industry. So there's really no huge, great desire to police this hugely flawed system with the potential for massive corruption, and honestly, with the potential for the massive ability to create major damage. So for that reason, you have to look at, these regulatory agencies, and you have to take what they say with a huge grain of salt, because although they should be out for your best interests, your tax dollars are paying their salary, many of them have a different and more nefarious purpose, which is, to move on and become a higher paid industry shill, so to speak. So you have to really, judge the information that's coming out of these agencies far more today than maybe even particularly in the past. Let's move on to number 8. Organic food isn't important. I hear this argument a lot, that organic food is no better than regular conventional food, and that pesticides are safe, and that we can't grow our food without pesticides and feed the people of the world. And I would argue very much differently. We don't have a food shortage in this country, or actually even in the world. We have an overabundance of food. As a matter of fact, a lot of years the government pays farmers to destroy food or to not grow food. So again, it's not an issue that we don't have enough. A lot of it has to do with commodity price control, and nothing really to do with feeding starving people or having technology to grow more food to feed starving people. And then you have industry influence, because a lot of farming is obviously influenced by the GMO seed companies and the GMO pesticide companies. So you've got that undue influence that's also playing a role. But if we look at the research on organics, let's just look at what we've got here. Organic diet intervention significantly reduces urinary pesticide levels in U.S. children and adults. So this published recently in the journal Environmental Research. Coming down here to the conclusion, an organic diet was associated with significant reductions in urinary excretion of several pesticide metabolites and parent compounds. This study adds to a growing body of literature indicating that an organic diet may reduce exposure to a range of pesticides in children and adults. And remember what we said earlier about the war against cancer. I mean, this is a perfect example of tying that back in. We know that many pesticides are carcinogenic. We know they're problematic, and some of the ones even that are approved. If we look historically at a lot of the pesticides that were approved in the past, many of them were banned as a result of cancer, and we have a lot of that same thing going on today. That the pesticide creation companies are pretty tricky. They come out with new versions so that we can't get validity as to whether or not they cause cancer yet, and then it takes a decade or so to finally realize that the problem is actually there. So again, pesticides, very potentially problematic. Eating organic reduces the exposure. It may not be perfect. Organic, there may be some people that cheat it. There may be some sprays and residues that are found in organic foods, but by far research shows that there's a tremendous difference quantitatively in the amount of pesticide exposure you get organic versus non-organic food. And then we also go down here, pulling this up off of National Institute of Health, toxic exposure to pesticides can result in short and long-term health effects. Immediate effects can include nose and throat irritation, nausea, and dizziness, while prolonged effects can result in conditions such as asthma, certain types of cancers, cognitive impairment, as well as reproductive health problems. We've also seen the linkage of pesticides to a number of different types of autoimmune diseases, especially neurological autoimmune diseases. So again, organic is better. It's worth the cost. Your health is worth it, and don't let anybody tell you differently. Okay, let's go to number 9. Chiropractic is dangerous. This is a message we've heard, the propaganda since the 60s and 70s. Don't go see a chiropractor. They'll kill you. They'll stroke your neck. This propaganda has been fostered upon mainstream for decades, and all in the name of safety, right? Chiropractors are dangerous, they're quacks. We've all heard that message. I, by trade, am a chiropractor. I have a chiropractic degree, among others. And so I wanted to educate you a little bit about how just untrue that actually is. One is, I want to make you aware of a lawsuit that occurred, Wilk versus the AMA. This was a lawsuit that occurred a number of decades ago. It was a chiropractor who actually sued the American Medical Association. Why? Because the AMA was purposefully creating false propaganda and statements against chiropractic, things that were totally untrue, in an effort to monopolize healthcare. Their goal was to eradicate any other form of alternative medicine, not just chiropractic, but also naturopathic medicine and acupuncture. And again, most forms of alternative medicine today are alternative, not because they should be. They're alternative because that's what we've been told by a very corrupt group of people who systematically set out to destroy alternative medicine because it played a threat to their bottom line. And so you can see here in this study published, it's a multi-part series, but you can see the AMA actions included influencing mainstream media, decisions made by the Joint Commissions on Accreditation of Hospitals. So they influenced the media, the hospitals, the Department of Health, Education and Welfare. Other actions included publishing propaganda against chiropractic and implementing an anti-chiropractic program aimed at medical students, medical societies, and the American public. After more than a decade of overt and covert actions, the AMA chose to end its committee on quackery. The following year documents exposed the extent of AMA's efforts to enact its boycott of chiropractic. You can read more about that. There's a really great book published called Wilk versus the AMA. Very, very enlightening on the corruption within the AMA and their design to destroy an entire profession for no other reason that they wanted the business. And if we're looking at it by the numbers, I thought I would also show you a few other things. Because this, chiropractic is not dangerous. If you want to look, follow the money, so to speak, this is a diagram on malpractice insurance premiums that doctors pay for it. If you look at chiropractic, these are annual malpractice premiums. A chiropractor pays about $1,600 a year for malpractice insurance. And insurance companies usually have their dollars dialed in pretty tight or they would go out of business. So again, the higher the risk of danger, the more the malpractice insurance costs. You can see of all doctors, chiropractic on the bottom of the list, lowest, meaning the safest. And then you go into psychiatry at $5,000, which is, psychiatry, a lot of that is talk medicine nowadays as opposed to, risky drugs or surgeries. And then you have family medicine paying about $10,000, internal medicine $14,000, anesthesiology $15,000, radiology $21,000, surgeons $34,000, and OB-GYNs $46,000. So again, of all the different types of doctor specialties, from a safety perspective, just following the numbers for malpractice insurance, chiropractic definitely on the low end, the lowest end of that. And then if you look also at death rates in the U.S., this study recently published, this a few years ago now, in British Medical Journal. In the British Medical Journal, found that medical error was the third leading cause of death, which is quite alarming and quite scary when you consider heart disease is number one, cancer is number two. The way we treat heart disease predominantly, the way we treat cancer predominantly is with medicine. And medicine and medical error is the third leading cause of death. There's actually an incident in California years ago where medical doctors went on strike and the death rates went down. Again, this isn't me trying to damn all of medicine. It's simply trying to inform you that there's risks inherent. Chiropractic has much less risk than mainstream medicine, and the outcomes in many cases are much, much better. And I think, especially if you look historically at drug-induced deficiency side effects, at medication-induced deaths, even from what we would consider to be benign medications. Aspirin kills about 13,500 people a year. Opiates, prescription and illegal, massive deaths, over 17,000 deaths a year. And those are just two different medications out of thousands of different medications. We have huge risk associated with using medicines. That's why when you get exposed to all these drug commercials at night watching news or TV, the guy at the end has to talk like an auctioneer, 1,000 words a minute to ramble through all the side effects. And now we've got drugs that treat the side effects of other drugs that are being marketed and used. So again, it's become a big problem because we spend about $4 trillion a year on medical treatments in this country, and many of those could be resolved if we would have the resolve to look at diet and lifestyle, not as alternatives, but as primary care in health. And I think when we start doing that, we'll save the American taxpayer and probably any other industrialized country that's going in this same direction, trillions of dollars a year in expenses. Hey, look, if you enjoyed tonight's show and you're struggling with autoimmune disease, you don't trust the government, you don't trust your doctor, and you need help, make sure you check out my masterclass on overcoming autoimmunity. It's free. Just check it out right here. It's got life-saving information that can help you bring your health to a whole nother level.